Hello everyone, I am Dr. Sandhya Deepika Uruganti, Consultant, Ferty9 Fertility Center, Second Path Branch. So today I am going to discuss about the importance of fallopian tube and infertility, and what are the reasons for fallopian tube block, and what are the diagnostic tests which help diagnose this fallopian tube block, and what are the treatments for this fallopian tube block. So first, what is fallopian tube? It is a very important hollow muscular organ actually, which helps in transportation of a mature egg and transportation of a sperm, and it helps in fertilization of the sperm and egg. So for fertility, this is a very important organ for fertility. So now coming to what are the problems. When is this fallopian tube block diagnosed? Normally, this fallopian tube block has no symptomatology. The only symptom many a times patient comes with is infertility. So when the couple comes with infertility, we first diagnose what are the how is the condition of the uterus, how are the ovaries, and how is the number of eggs in the ovary, and then the patency of the tubes. In the sequence of the tests, we'll test those fallopian tube patency also, and it is diagnosed that way. So there are a few different tests to diagnose fallopian tube blocks. The first is HSG, which is time tested test, hysterosalpingography, and then saline infusion sonography is also used to diagnose the blocks. And the final and the most important diagnostic test is the laparoscopy and with CPT, chromoperturbation. We do a diagnostic laparoscopy and we pass a dye from the uterus, through the vagina from the uterus, and we see the spill inside the cavity through the laparoscope. So this is most diagnostic, and in that sitting itself, we can do a fallopian tube cannulation and see. We can correct it also, the fallopian tube block, at one sitting. So what are the reasons for this fallopian tube block? There are multiple reasons. The common reasons are the infections, the ascending infections from the genital tract, which causes little inflammation and fibrosis in the tube and causes the block. And pelvic inflammatory disease, severe infections, adhesions in and around the abdominal cavity, and disease like endometriosis also causes fallopian tube blocks. And any previous surgeries also causes the fallopian tube block. And what are the main treatments? If the fallopian tube is blocked, how can the couple conceive? That is the main question everyone will ask. So the thing is, we can do a laparoscopic tubal cannulation, hysteroscopic tubal cannulation under laparoscopic guidance and all. That helps to a smaller extent. The mainstay of treatment when there is a fallopian tube block is IVF therapy. So IVF technology helps in bypassing the activity, the fertilization which happens in the tube, and helps the couple to conceive. So that gives a major benefit when there are no issues in the sperm factor and no issues in the uterus, and the quality of the egg is good. IVF majorly helps in patients with fallopian tube block. Thank you.